So our next question is related to the use of cannulas. And for those of you who don't know, a cannula is a device that we use to inject dermal filler. It's a little different from a needle in that a needle is very sharp. A cannula is actually kind of dull. So they're similar in terms of the caliber, so the dimension or the diameter is similar. But at the very end, if you enlarged it, it would have a very rounded tip. So a cannula won't actually go through the skin, so you have to make a little nick in the skin to get the cannula through. But once it's underneath the skin, it will pass fairly easily in through the soft tissues underneath. So what we sometimes will do with dermal fillers is we'll make a little nick in the skin away from the area that we want to augment, and then just pass a little cannula through that area. Because the cannula is blunt, it tends to not cut through blood vessels or cut through tissues. It tends to sort of pass along them or sort of move them out of the way. So the thought is that using a cannula is less likely to cause bruising and is less likely to inadvertently deposit product right in a blood vessel, which can have very serious complications. Now, does that happen with cannulas? It's possible. Is it less likely than if a needle were being used? Possibly. We certainly do see a decrease in the amount of bruising when we use cannulas, so I like it for that reason. I don't think it makes a difference for swelling whether you use a blunt cannula that is placed, remote from the area that you're trying to inject, or whether you inject directly with a needle. But I think there's certain safety advantages and a decrease in bruising that you get with the use of a cannula. I also think that cannulas can sometimes give a really nice result in areas where a deposit of filler is going to give an ideal result. So for example, along the vermilion border of the lip, use of a cannula through a little injection site laterally can allow for a really smooth deposit of filler along the length of the lip. In other circumstances, however, I think that needles can be more accurate. So I know myself personally that there's some areas, for example, the smoker's lines, I would find that very difficult to use a cannula. Cannulas are long and they're sort of flimsy and flexible, and I think in the area around the lip it would be very hard to use a cannula to inject little fine lines. So there's definitely areas where the accuracy that is allowed by using a very small, sharp needle is very advantageous, and other areas where using a cannula where you may get a little less bruising and you can deposit the filler in a different way also has its advantages. So both are good. I think it's important that our nurses are skilled at using both of these techniques, and in most of our patients it's a combination of the two that gives the best result. Our registered nurses are injection experts. They use both cannulas and needles for placement of the filler subcutaneously. I think they often use their experience to decide which technique is going to be best for an individual patient. Occasionally patients will have a very specific request. Maybe they've been to a clinic before where they've used cannulas and didn't have a good experience, so they want to use a needle, or vice versa. And so I think we do cater to the patient's requests as well. But experience is key, and our nurses have been doing this for years and years, having done thousands of injections, and I would really trust them with all of our patients to get very good results that are very safe.